Welcome to Intentional Rounding. I'm Lisa Johnson, the Chief Nurse Executive for the Wharton Plant East Hospitals, but today I'm here on behalf of all of BayCare nursing leadership. You may have called intentional rounding many things in the past: hourly rounding, care and comfort rounds, quality rounds, but we're here today to standardize rounds across BayCare. It is an expectation that all team members will participate and complete hourly rounding. We need to help each other and hold each other accountable. I hear nurses say, and all team members actually that do hourly rounding, but Lisa, I'm in and out of the rooms all the time. Why do I need to do that? Having a formalized approach has proven to truly be helpful. In this short video, you will learn the how and why of hourly intentional patient care rounds. We will discuss 5 P's that provide a reminder of the 5 items to be addressed each time we work with patients: plan of care, potty, pain, positioning, and possessions, and this includes a safety suite. Hospitals that are successful say that consistency and participation of all are the keys to success. Hourly intentional rounding is evidence-based, and it leads to better outcomes, fewer falls, and better pain management. It helps you to manage your day and can give you some time back at the end of the day to focus on things you want to get done, like last-minute touches on documentation.
Hi BayCare team members. We are now in a lab setting and we want to show you the intentional rounding and how is it done. We want to show you the 5 P's and how are we going to incorporate this in our hourly rounding. Lee and I will role play. I will be the patient and Lee will be the PCT. So enjoy the show and we will show you how it's done.
Washing my hands. Good morning, and your name is?
Ian Park.
Ian Park. When's your birthday?
January 28, 1986.
Hi, my name is Lee. I'm going to be your PCT for today. But I'm going to be back shortly. I'm going to put everything where you can get it, your urinal, your... Listen, I'll be back shortly, okay?
Okay. Lee, come back. What do you think, how did you think you did? Did you do excellent, good, or fail?
I think I did good.
I think you did good too. I saw that you did very good on possession and safety. You make sure that all my possessions are within reach and I'm safe in bed. But we want to discuss this intentional rounding, that we need to be efficient and effective on this when we go into the room, because that's our opportunity. So let's discuss the 5 P's. So let us discuss the first P, which is plan of care. Plan of care is very important for our patients' needs. Do you see that whiteboard over there? You can use that whiteboard as a hint for you for your plan of care discussion with your patient. First is your phone number. That is very important. So you need to discuss that with your patient. And also, you see that there's a goal for the day. Get out of bed every meal. You can freely discuss that to your patients. If you tell me that Mr. Park, we are going to get up in bed during lunchtime, it is a very good thing that we can work on it all throughout the day. Also, in this plan of care, I want you to make sure that you're telling your patient what will be the next activity that will happen every time you do your rounding. The next one in the 5 P's is pain. Pain is very important for patients. Do you think of any alternative things that you can do to alleviate my pain?
What I would do to relieve your pain is I can find out what your number is, and then I could make you as comfortable as I can. If it's fluffing your pillows, if you're too warm, I can pull the blankets down. If you're cold, I can get you a warm blanket or give you a cold compress for your head.
That is very good. Pain, as you know, is sometimes chronic, acute, and sometimes we don't know what's causing the pain. Alternative pain interventions are very important to alleviate pain while the pain medication is not underway. You can talk to your nurse and tell them that the patient needs pain medication. And when you do that, make sure that the patient knows the time and that you already informed the nurse. And if you are not busy, it is best to stay at the bedside until the nurse comes in and handles the pain. How about also ask the patient, where is the pain coming from? Because if it's a chest pain, you're going to need to run and ask for the nurse, right?
Yeah.
But if it's something like a knee pain or a hip pain, you can maybe give me some ice pack to relieve that pain while I'm waiting for the nurse.
Let's discuss the next P, the third P, which is potty. Now, potty is everyone's job. It is not nurse or PCT that has this job responsibility. It's everybody. Patient needs to go, they need to go. So we need to make sure that if patient wants to go potty, we need to immediately handle that situation. So if a nurse comes into the room and say that the patient wants to go to the bathroom, the nurses needs to put the patient in a bedpan or maybe walk them in the bathroom and then communicate to you that they put the patient in the bedpan or in the bathroom so you can be able to assist them to remove the patient in a bedpan or help them back to bed.
How about I ask you, Lee? If you are in an isolation room, what are you going to do?
Well, the first thing I would do would be to encourage the patient about the potty when I was in there to help them. Every person needs to go to the bathroom within a 4-hour period. So I'm going to encourage you, if at that particular time you need to go, that I have time to take you. Before I go to the isolation room, I like to call the monitor tech and my nurses and to inform them that I will be in the isolation room and will not be available to assist with emergent and urgent issues at that time.
Communication is key, Lee.
You know, unit clerks are very important aspect support system in our healthcare system. They can divert the call of the patient if you did not respond in the first time. So they can manage the patient's needs right there and immediately answers through the lights.
Because after all, we're trying to make sure that patient is satisfied every time. Now let's talk about the next P in this 5 Ps, which is positioning. What can you do in positioning?
Positioning, I can make you comfortable. I can make sure that if you're sitting too long in the same place, to reposition you. If you're a patient that has total care, to turn you every 2 hours.
That is very good. Positioning is very important in our intentional rounding. Any staff member that goes into the room needs to make sure that the patient is comfortable in their bed or if they're sitting down, so that they feel like they are being taken care of in that hour.
Let's discuss the last P, which is possession and safety. And you did a very good job on this, making sure that everything in my bedside is right there. But I want to give you a recommendation. When you do this last P, which is possession and safety, you need to ensure that you're looking into the whole environment in the room. Because you know, sometimes there'll be family members in the room. We know that these family members sometimes are the one filling up the patient satisfaction survey. So we appreciate their perception all the time. Now also, because this is the 5th P and the last P in the 5 Ps, we need to make sure that you are not seen as hurrying up. You need to ensure that you show eye contact with your patient and sincerely asking the patient, do you need anything else? I want you to maybe gesture to the clock that right now it is 3 o'clock and you want to come back in an estimate time of about 4:15 to 4:30. This will give me an assurance that you will be there at that time. What do you think about this?
Thank you so much, Mr. Parks, for all you did to encourage me, and have a great day.
Thank you so much, Lee. Come in.
Washing my hands. Hello, my name is Lee. I'll be your PC teacher for today.
Hi, Lee.
What is your name?
Ian Park.
Can I see your name band, please?
Sure.
And your birthday?
January 28, 1986.
Hi, okay. Well, my name is Lee, and I'm going to go over our intentional roundings with you today. There are the 5 Ps. Plan of care, which is on your whiteboard, which is available. It lets you know what we're going to do for today. Your whiteboard says get out of bed for every meal. So I'm going to get you up for breakfast and then put you in a chair, and then we'll do your bath and all that, stuff that we need to do.
Thank you.
The next one is pain. Are you in any pain right now?
I'm actually okay right now.
If there's anything I could do, please feel free to call me and let me know, and we'll either do an ice pack or something, a warm blanket or something like that. What about potty? You've been in the bed all night. It's morning. Would you like to go to the potty?
Well, I think I'm still okay.
You sure?
Yeah.
Okay, because everyone has to go to the potty within a 4-hour period, and don't hesitate if you need me. You can just hit your call button at any time. The nurse or I will come in and take you to the potty. What about your position and how do you feel?
I think the pads at the back is kind of folded, but we can do that when I get it up.
Okay, that'll be fine. Here are your possessions. We're gonna put them close to you, okay? So here's your call bell. This is your call bell. If you need me, you hit the red button. That's the nurse or I will come. Your water and your urinal and your glasses to read your menu with. Now, we do rounds every hour. It's 8 o'clock in the morning now. I'll be back between 9 and 9:15 to make sure you're okay. Is there anything I can do for you?
I think that's it, Lee.
Are
Thank you
you
so much.
sure?
I think-
I have time.
Thank you.
You're important to me.
Thank you so much.
All right. Again, my name is Lee. Don't hesitate if you need me. I'm just a phone call away.
See you in an hour.
Hi Gina, how are you doing today?
Hey Ian, you know what, I'm good, but man, it is a busy day. Well, you know, we were short staffed today, and I am just so busy. I've got patients going off the unit. It is just wicked busy.
I know, it's just a busy day today. I want to talk to you about something, about intentional rounding. How is that going with you?
Really? Well, on a busy day, it hasn't really got started today. I will have to tell you that I've been in and out of the room many times. I'm not even sure why we need to do these.
You know, Gina, I want to make sure that you understand why are we doing this intentional rounding. Our goal is to enhance the patient experience without adding more to your to-do list. We need your support in this initiative to help improve the quality of patient care. How about let's do this consistently and efficiently? Study shows that nurses' workload drastically change and become better 20%, and 52% of falls are reduced. So if we do this consistently and efficiently, we can impact patients' results and also patient satisfaction thereby. So how about this? I will go in the room with you and present to you how we're going to do this 5-piece, and then maybe next time you will show it to me how, and then we can do it together.
I think that's a good idea, and I didn't really think about all of those things about decrease in time. So thanks for sharing, and let's go try it together.
Okay, thank you.
On Sunday, I was caring for a patient. My 4th time in there to see him, he said, "Come on in and have a seat." I sat down on the side of the bed in the chair, and he said, "Can you tell me how your pain is?" I looked at him. He said, "What about your position?" He said, "Sit back in the chair and make yourself a little more comfortable." I said, "Okay." He said, "I can even assist you to the potty." Now here's my cell phone, so I want all your possessions really close to me. I said all that to say that quality rounds, once we start doing them and being effective doing them, the patients will do them for us. Thank you so much.
Intentional rounding is very important in all healthcare system. I think if we do this consistently and efficiently in our daily routine, we can impact patient satisfaction drastically. Patient feels like they are assured that there is somebody really taking care of them with their hourly needs. The 5-piece, we need to inculcate that in our daily routine and an hourly routine for our patients. We need to remember those 5-piece, because if we do, the patient feels like, I don't need to really, ask for anything. Everything is provided for me. And that's what we really wanted to do. We want to make sure that needs of the patient is taken care of. And also in our unit, we have drastically decreased the amount of colites patient does, because we are there every hour and every estimated hour that we want them to be. So if we do this Baker-wide, I think we will be successful. Drastically decrease colites, and our intentional rounding will be successful.
You know, at first when I started doing intentional rounds, I thought it was going to take so much time. But what I actually found is each and every time I went into the patient's room, it got easier and easier. You know, it was because I had a plan, and I went over the 5-piece with them. Our patients actually knew, to where at times when I would actually go in, they would be asking me and telling me what I already knew before I asked. So actually it really does work. It has decreased my time, and it has increased our patient satisfaction.
It is true that if we do not do intentional rounding, it can affect our patient experience scores. But it is not about the scores. It's about creating a positive experience for our patients and family. Just think of this as a reflection of your care.